Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Measles. Introduction. Measles is an infectious disease caused by a virus that spreads easily from person to person. The main symptom of measles is an itchy skin rash.
Sometimes measles can lead to serious problems. There is no treatment for measles, but the measles-mumps-rubella, or MMR, vaccine can prevent it. A vaccine called MMRV protects against measles, mumps, rubella, and varicella, chickenpox.
This program will help you understand measles and how it affects children and adults. It discusses the symptoms, diagnosis, and prevention of measles. It also contains information about a measles vaccination. Measles.
Measles is a respiratory infection caused by the measles virus. It produces a full-body rash.
The measles virus normally grows in the cells that line the back of the throat and lungs. Measles causes fever and a rash. In rare cases, it can cause serious complications. People who are not fully vaccinated against measles or have not had the illness are at risk of getting measles. Most cases of measles are related to travel outside of developed countries by people who have not been vaccinated. Measles is highly contagious. It can spread to others 4 days before to 4 days after the rash appears. Measles is so contagious that if one person has it, 90% of the people close to that person who are not immune will also become infected. The measles virus lives in the mucus of the nose and throat. When an infected person sneezes or coughs, droplets spray into the air. This can spread when a person touches an infected surface and then touches his or her mouth, nose, or eyes, or breathes in infected air. The measles virus can live on infected surfaces for up to 2 hours and spreads so easily that people who are not immune will probably get it when they come close to someone who is infected.
Measles is also known as rubeola. This should not be confused with rubella, which is a milder illness. Rubella was once known as German or 3-day measles. Symptoms and diagnosis. Measles symptoms generally begin about 7 to 14 days after a person is infected. Measles symptoms include blotchy rash, cough, feeling run down or achy. Other symptoms of measles include fever, red watery eyes, runny nose, tiny white spots with bluish-white centers found inside the mouth. These are called complex spots. A red or reddish-brown rash appears 3 to 5 days after the start of symptoms. The rash usually begins on a person's face at the hairline and spreads downward to the neck, trunk, arms, legs, and feet. When the rash appears, a person's fever may spike to more than 104 degrees Fahrenheit, 40 degrees Celsius. After a few days, the fever subsides and the rash fades. Measles is suspected when a person feels unwell, has a cough, runny nose or sore eyes, and a fever followed by a rash. The rash and tiny white spots inside the mouth may be enough to diagnose measles. A blood test can confirm the diagnosis.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Complications. About 30% of measles cases develop one or more complications, including pneumonia, ear infections, diarrhea. Complications are more common among children under 5 years of age and adults over 20 years old. Even in previously healthy children, measles can be a serious illness requiring hospitalization. As many as 1 out of every 20 children with measles gets pneumonia, and about 1 child in every 1,000 who get measles will develop encephalitis. For every 1,000 children who get measles, 1 or 2 will die from it. Measles also can make a pregnant woman have a miscarriage, give birth prematurely, or have a low birth weight baby. Vaccination.
The most common vaccine used to prevent measles is the MMR vaccine. MMR stands for measles, mumps, and rubella. It is a common childhood vaccine. The MMR vaccine is strongly endorsed by medical and public health experts as safe and effective. 2 doses are recommended for children. The first dose at 12 to 15 months of age. The second dose before entering school at 4 to 6 years of age.
If you were born during or after 1957 and have not had measles or been vaccinated, you are at risk of measles. It is recommended that you get at least 1 dose of MMR vaccine.
2 doses of MMR are recommended for adults who are at higher risk, such as college students, trade school students, or other students beyond high school. Those who work in a medical facility. Other adults at higher risk include international travelers or those who are passengers on a cruise ship, women of childbearing age. Pregnant women should wait to get the MMR vaccine until they have given birth. Women should not become pregnant for 28 days following an MMR vaccine.
Treatment. People with measles infections are normally told to rest, drink plenty of fluids, and take acetaminophen to treat the fever. There is no specific treatment, but supportive care can help make the person comfortable. Supportive care consists of drinking lots of fluids to prevent dehydration, getting plenty of rest, taking over-the-counter pain relievers. Do not give aspirin to children younger than 18 years. Aspirin has been linked to severe medical problems when used by children.
It is important to call a healthcare provider if a fever goes over 101 degrees Fahrenheit. Women who are pregnant and may have been exposed to measles should call the healthcare provider even if they don't show any symptoms.
While a person is infected with measles, it is important that he or she remains at home to reduce the possibility of spreading it to other people.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Measles is a respiratory disease caused by the measles virus. This virus normally grows in the cells that line the back of the throat and lungs. Measles causes fever, runny nose, cough, and a rash all over the body. About 1 out of 10 children with measles also gets an ear infection, and up to 1 out of 20 gets pneumonia. About 1 out of 1,000 gets encephalitis, and 1 or 2 out of 1,000 die. Measles spreads through the air by breathing, coughing, or sneezing. It is so contagious that anyone who is exposed to it and is not immune will probably get the disease. There is no specific treatment for measles, but supportive care can make a person comfortable. People with measles infection are normally told to rest, drink plenty of fluids, and take acetaminophen to treat the fever.
A vaccination is available to prevent measles. The most widely used vaccine is the MMR vaccine. MMR stands for measles, mumps, and rubella. It is a common childhood vaccine. Thank you for using Explain.